enlightening conversation, and I'm learning so much just by engaging with you this couple of minutes. But I mean, looking back in your career and what you continue to do, what are you most proud of? In the things that you've done, what are you
That's
most proud of?
that's
That's
easy.
easy.
And it's
And
a
it's a
generalization, but
generalization,
it's
but it's
easy.
easy.
I'm
I'm
most
most
proud
proud
of the
of the
young
young
women that
women
I've
that I've
had the
had the
honor and
honor and
privilege to
privilege to
mentor.
mentor.
Mm-hmm.
They know
They
I
know I
call them
call
my
them my
retirement
retirement.
plan. Um, I mentioned already that too often you're the only black only woman in the space, and so the women that have had the
Had the
honor
honor
to
to
support in
support in
various
various
ways through
ways through
mentorship
mentorship
and
and
etc.
etc.
Just
Just
sometimes
sometimes
just by
just by
being
being
a
a
navigator.
navigator.
Mm-hmm.
I
I
keep saying
keep
to them,
saying to them,
we're not
we're
going
not
to
going to
solve it.
solve
The
it. The
next
next
generation,
generation
they're
that
right
they're right
behind them.
behind them,
They're going
they're
to
going to
address this
address this
because
because
that
that
is
is
easily
easily
the
the
thing
thing
I'm
I'm
most
most
proud of.
proud
I'm
of.
not
I'm
going
not
to
going to
name any
name any
names.
names.
Those who
Those
know
who
me
know
know
me
who
know who
they
they
are.
are.
But
But
there's
there's
so
so
many
many
amazing
amazing
women
women
with
with
the, like I
like I
said, they've
said, they've
ticked all
ticked
the
all the
boxes on
boxes
those
on
things
those
they
things
say
they say
women need
women
to
need to
do to
do
be
to be
able to
able to
succeed,
succeed,
and they're
and they're
doing
doing
more. They're
more.
the
They're
ones
the
that are
ones
going
that
to
are going to
break
break
down the
down the
system that
system
we're
that we're
struggling
struggling
with
with
and
and make it
impossible
impossible
for it
for it
to
to
remain.
remain.
So
So
that's
that's
easily,
easily,
I'm
I'm
most
most
proud of
proud of
having
having
whatever
whatever
tiny
tiny
influence I've
influence I've
had in
had
their
in their
careers.
careers.
That's what
That's what
I'm
I'm
most
most
proud of,
proud of.
because
Because
it's
it's
people
people
that
Yeah.
will
that will
change the
change the
system.
system.
Yeah.
It's
It's
people.
people.
Well, mentees, if you're watching us, you know who you are. So shout out to you, and make sure you're doing exactly what
Oh, I
Mr.
Oh, I
know.
Ebere
know
wants
they
you
are.
to do.
I
I
know
know
they
they
are.
are.
Okay.
I
I
know
know
they
they
are.
are.
Okay, but before we go, I know, especially as you've said, in the field of public health or global health, sometimes the path can seem so daunting, especially for early career professionals. What advice would you offer based on your journey so far?
So it was, I think it's Paul Farmer who he had a much more elegant way of saying it, but the bottom line was that public health is about equity. And so for anyone who, I get a lot of people saying, I want to be work in public health, I want to work in global health. The first question I ask them is, do you understand what equity is in that space? Because if your driver is, I want to be the next director general of whatever WHO and all that, that's the wrong that driver. The driver has got to be about equity. And so the first thing I say to them is, you can be part of the global health problem or solution depending on the lens through which you look at it. And if you look at it, and I remember having a conversation with someone who, she wasn't very happy, or I think it was she wasn't very happy at the end because she wanted me to help her work, and this was a conversation in the UK, work abroad in global health. And I recognized she actually lived in Liverpool in the northwest of England, which has significant health disparities and challenges there. And I said to him, so what are you doing to address health equity in Liverpool? Do that. That's global health. Global health isn't just what somebody in the global north comes to do in the global south, and we can talk about that whole terminology of global north and global south. Well, we can discuss that on a different day. And you guys have spoken to people who are far more versed in that subject than I am. So the advice I give someone who wants to get to work in global health or in public health is, first of all, know why. So I keep saying that TB was what brought me to global health, and the foundation was it equity, was the fact that the reason why patients couldn't, got TB in the first place. So the factors that contributed in getting TB or having
Having
poorer
poorer
outcomes on
outcomes on
like
like
resistant
resistance
than
than
sensitive
sensitive
TB,
TB,
whereabouts
whereabout
they didn't
they didn't
actually have to do with the health system themselves. But even when they did, it's about equity of access to opportunity, to knowledge, to services. And so I think the first thing is to be clear about why you want to do public health, do global health. And then when you're clear about that, people I've had questions about, oh, should I do a PhD? Should I do a GRPH? So first of all, I would say that what a master's in public health gives you is the language to enter the profession to discuss the topics and terminology. And therefore, I recommend that if you have the opportunity to get a master's, it doesn't matter, it doesn't have to be in London School, Liverpool School, Harvard, all that. A good master's degree that won't break the bank, preferably, um, gives you the language to then enter the conversation. But beyond that, global health is about equity. It's about doing. It's about recognizing. It's about any room you're in, looking around and saying, who is not here, who should be here. And if you take that perspective, your path will you will flow down the path that you need to be in, and you will make a difference. Even if it's whether you're working at community as a community health worker or you're the director general of WHO, it's got to be about the lens through which you look at the problems. And for me, the most comprehensive is about equity.
Thank you so much. Thank you so much for ending on that note. I think this has been a very insightful conversation, and I'm truly glad that you're able to join us on this episode of the Global Health Uncensored. Um, Thank you so much for your time.
Thank you.
Regards to everybody.
Thanks for
Thanks for
having
having
me.
me. Yeah.
Yeah.
To my viewers, you've seen the kind of content you're having. We're going to be having series of contents on global health, specifically in the context of health systems in Africa. So stay tuned for the next episode. Thank you so much.
Great.